Welcome back. This is Dr. Jin Sung. We are in the middle of a heat wave here in the Northeast, and make sure to hydrate and make sure you eat your food and chew your food so you don't develop something called gastroparesis. Today's topic is gastroparesis, okay? So what I'd like you to do is share this video because a lot of people have this problem and they take a lot of antacids and they don't know what's causing their symptoms, and it's causing problems in the long run. So, what is gastroparesis? Basically, it means gastro means stomach, and paresis means paralysis, or it's not moving. So your stomach is not emptying the food that you eat. So you have these people, they eat, they're like, oh, it's just sitting here. It's like hours later, it's like lunchtime. I'm not hungry, my stomach, I just feel like it's burning, right? So these people might have gastroparesis. So the two main causes they say in the literature is, one is diabetes. Diabetes, it affects the nervous tissue or small fibers of the nerves, and it can create a decreased contraction of your stomach, right? So your stomach is not able to contract, therefore you can't move the food along. So a lot of people think that digestion actually occurs in the stomach, in absorption. Digestion partly starts in the stomach, and the absorption really starts in the small intestine, okay? So the stomach will go in, and there's a pyloric sphincter, and it goes into the small intestine. And that's where the digestion really starts, okay? Now, your stomach has to be acidic. In order for proper digestion to occur, the stomach needs to be acidic. The acidity triggers the gallbladder to contract and your pancreas to release pancreatic enzymes, so digestion can occur. So if you have gastroparesis and you're taking a lot of antacids, then you're exacerbating the problem by not contracting your gallbladder nor releasing pancreatic enzymes appropriately. So if you have a cause of diabetes, then you have to fix the diabetic issue for your stomach to contract properly. The other main cause, right, the real main cause is idiopathic gastroparesis. Basically, they don't know why. They just call it, you have a slow moving system. But we know that it's actually a neurological problem. So if you have a slow emptying stomach, it's most likely a neurological issue rather than a issue with enzymes and so forth in your stomach, okay? So let's go over some symptoms of gastroparesis. So symptoms can include very similar to GERD or reflux disease, right? Acid reflux, nausea, some weight loss can occur, bloating, GI complaints, burning. You can develop ulcers or even Barrett's esophagus because you're not digesting or moving the food along. And then gallbladder and pancreatic issues because you're not contracting, because your stomach needs to be acidic for them to work, right? So you have these common symptoms, and those symptoms can lead to malabsorption issues. And then malabsorption issues can lead to decreased brain function, increased muscle wasting. So you work out, you're not building muscle because you're not absorbing your proteins. Also osteoporosis because you're not absorbing nutrients or your minerals properly. And fatigue. Fatigue is a very common one because you need your nutrients to fire, right? You need your cells and your mitochondria to fire, but without the proper nutrients, you are going to get tired, right? So some of the symptoms that you find in children are going to be like ADD or ADHD or autism spectrum kids, where they're not firing the brain properly, therefore they can't digest their foods and they look bloated, right? Those kids can be having gastroparesis. They're not emptying their foods properly. They become constipated, okay? In adults, it can be memory issues, fatigue, anxiety is a big one. So anxiety can create a problem when you have gastroparesis. So look at those signs and symptoms, right? And sometimes people come into the office and they already have a diagnosis of gastroparesis. And I ask them, you know, did you do the proper testing to figure that out? And they go, oh, I was just told that. They didn't run any tests. They told me I have gastroparesis, right? The proper way to really test it is a gastric emptying test, where you will eat a certain food, and then 1 hour later it should have emptied about 10%, in about 2 hours 40%, and by 4 hours really most of it should be gone, or less than 10% left over, right? So there is a specific test for gastroparesis, and you have to make sure you have the proper testing done to have the proper diagnosis, right? So if you have the diagnosis of gastroparesis and you're not diabetic, then you have to say it's idiopathic or unknown cause. But what I'm telling you is the cause is a neurological problem. And the neurological problem lies in the vagal system, or the vagus nerve, right? This nerve is a cranial nerve that lies in the brainstem. So your brainstem, which is just above all your cortex, or cortices, right, is responsible for contraction of your stomach. It kind of goes down, it's everywhere. It's like a wandering nerve. It goes into your organs, it goes into your stomach. You have to have proper vagal function in order to have proper digestion, proper stomach contraction, proper colon contraction for bowel movements. So vagal stimulation is very important. Now, the way to diagnose that really is when you look at someone and you tell them go ah, 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 and you look in their mouth, you have the soft palate and the uvula that hangs down. So when you go ah, 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 this has to go up together, and it should be a good movement. If it moves and pulls to one side or pulls the other way, or there's lack of movement there, then you may have a poor vagal system, a poor vagus nerve, right, which innervates your GI tract. If you have poor function there, you can develop gastroparesis. So how do we stimulate it? So in our office we have a vagal stim that we can utilize, or if you want to do something on your own, you can do vigorous humming, gargling, and gagging. I would suggest starting with gargling. Gargling very vigorously, right? Like to the point where your eyes tear, right, and rolls down your cheek. That's how vigorously you want to gargle. So you look up towards the ceiling and you gargle really loud in the shower, and that will start to tonify that area and starts to spread down into the GI tract, so you can digest better, you can have better bowel function, and so forth. Of course, nutrients are important for healing. If gastroparesis sets in, you can have damage, you can have ulcers, you can have issues. So healing needs to occur in those areas also, right? And then patients like this almost invariably will develop things like leaky gut or intestinal permeability, where things that do not cross the gut barrier will start to cross and cause inflammation, right? So things we do in our office is eliminate those inflammatory foods, seal that gut, improve the vagal tone so that you can function better, right? Neurologically, there has to be some work done in order for that brain to fire appropriately to the GI tract, okay? So those are some tips that you can try at home. Gargling, gagging. Gagging, I would be very careful. You can use your toothbrush when you're brushing and just kind of hit the back of your tongue. See if you can get a gag response. Okay. Once you get a gag response, you may tear, and that's the one way you can stimulate your vagal system. All right. If you Google vagus nerve stimulation or natural ways to stimulate your vagus nerve, there will be many websites that will help you do that. Things like meditation and so forth. Okay. My name is Dr. Jin Sung, where clinical excellence meets excellent results, and we'll see you next Tuesday at 12:30 on the healthy side. And next week's topic is going to be a very important one. It's going to be on anxiety and depression. How do we help those patients, right? So give you a little tip, look up neurofeedback. Neurofeedback. It's a machine that we have in this office and works phenomenally well for those patients who have anxiety and depression. So look that up, and we'll see you guys next week on the healthy side. Have a great day.